Do you often feel like one leg is weaker than the other when walking stairs? Or maybe your vision gets blurry for no clear reason. These might not just be tiredness. Sometimes they're clues your body is sending. Multiple sclerosis, or MS, is a condition where your immune system, which normally fights germs, accidentally attacks your brain and spinal cord. Think of your nerves like electrical wires, and MS slowly damages the insulation. This can slow down or block messages between your brain and body. It's like when your phone charger frays and doesn't charge well, your body's signals start skipping or failing. It usually starts between ages 20 and 40, and women are more likely to get it. But the good news, many people with MS live full, active lives, especially when they catch it early. So why does the body attack itself? We don't know the exact reason, but it's like a friendly fire mistake by your immune system. It damages the myelin, the fatty coating around nerves, like chewing through the rubber cover of a wire. Experts believe MS might start from a mix of genetics and environment. For example, if your parent has MS, your risk is slightly higher, but it's not passed directly like eye color. Also, people who live far from the equator, like in Canada or Northern Europe, get MS more often. Could sunlight be part of it? Possibly. Less sun means less vitamin D, and low vitamin D links to higher MS risk. Some viruses, like Epstein-Barr, the one causing mono, are also being studied as possible triggers. Imagine your immune system remembering a virus and accidentally targeting nerves instead. It's not caused by one thing, but a web of small risks adding up. MS symptoms vary a lot because it affects different parts of the nervous system. Think of it like a city's power grid, failing in random places. One day, your legs feel heavy, like walking through mud, called muscle weakness. Another day, your vision gets foggy or painful when you move your eyes. That's called optic neuritis. Some people feel numbness in hands or face, like when your foot falls asleep, but it won't wake up. Others struggle with balance, feeling dizzy when standing up. Fatigue is a big one, not just being tired, but a deep exhaustion that doesn't improve with rest. Some even have bladder issues, like sudden urges to pee. These symptoms might come and go, relapsing, remitting, or slowly worsen. If you've had 2 or more of these issues, especially at different times and places in the body, talk to a doctor. Diagnosing MS isn't like a quick lab test, it's detective work. Doctors ask, have you had vision trouble and leg numbness months apart? Then they order an MRI, which takes pictures of your brain and spine. On the scan, damaged areas look like bright spots, proof of past attacks. They might also test your spinal fluid by doing a lumbar puncture, a needle in the lower back, to check for immune activity. Not fun, but helpful. Once diagnosed, treatment starts early to slow damage. Medicines called disease-modifying therapies, DMTs, quiet the overactive immune system. Think of them as peacekeepers calming a riot. For symptoms like fatigue or stiffness, physical therapy and medications help. For example, cooling vests can reduce heat-related symptom flares, super useful on hot days. It's not a cure, but treatment can give people years of stable health. Right now, we can't fully prevent MS, but we can lower risks. Think of it like weatherproofing a house. Sunlight and vitamin D may help. Studies show people with higher vitamin D have lower MS risk. So safe sun exposure or supplements could be smart. Avoiding smoking is key. Smokers are more likely to develop MS and get worse symptoms. Also, staying active and eating well supports overall nerve health. While you can't change your genes, you can control habits. For people with a family history, tracking early signs helps catch MS sooner. And if you had Epstein-Barr virus mono, just stay aware, don't panic, but don't ignore strange symptoms either. Exciting advances are happening. One big breakthrough is BTK inhibitors, new drugs taken as pills that may protect nerves directly and calm the immune system. They're in trials now and could work even in later MS stages. Another cool area is repair, the idea of remyelination, or healing the damaged nerve coating. Scientists are testing drugs that might wake up stem cells in the brain to rebuild insulation. Also, home MRI trials are starting. Imagine scanning your brain weekly from your living room. AI is being used to read MRI scans faster and catch tiny changes. And research into the gut microbiome shows that gut bacteria might influence MS, so probiotics or diet changes could one day be part of treatment. It's not science fiction, these tools are being tested now, offering real hope.